Well, good evening, everyone. I'm jspellman. Today I'll be giving you an informative speech on a blighted ovum. I'm going to discuss what a blighted ovum is, what are the causes of a blighted ovum, some risk factors for females that can increase your chances of having a blighted ovum, and also treatment procedures for a blighted ovum. Recently, my wife and I found out that we were pregnant with our third child. While this was very shocking news, we were very excited. Then upon her initial ultrasound appointment, the doctor told us that he was very sorry to inform us, but there was no baby there. So we were really shocked, but you know, life gives you things, you just gotta get past it. So, what is a blighted ovum? A blighted ovum is, according to doctors Tulandi and Alfasan, a pregnancy with an empty gestational sac is a pregnancy in which amniotic development arrested at a very early stage or failed altogether. Okay, what that basically means in our terms that we can understand is that for a woman to have a healthy pregnancy, you need three things. You need a gestational sac, a yolk, and a fetus start to form. In the case of my wife, she only had a gestational sac. Number two, some causes of a blighted ovum, or the actual cause of a blighted ovum, would be, according to AmericanPregnancy.org, this is the result of chromosomal issues. A woman's body recognizes abnormal chromosomes in the fetus and decides to discontinue the pregnancy. It's basically the female's body recognizing that there's something wrong and it's time to not let this pregnancy happen, and the body goes into a miscarriage. The abnormal chromosomes are usually caused by abnormal cell division, poor quality of the sperm or the egg. A blighted ovum is also the cause of 50% of first trimester miscarriages. So it's actually pretty common. All right, there is actually no known way to prevent a blighted ovum. It just happens. And if it does happen, it's only typically happens once. So that's pretty good news for people that have had it before. Some factors that increase a woman's risk of having a blighted ovum would be while she is pregnant, taking prescription medications, using drugs or alcohol, and it's also the mother's maternal age. Basically, that if a woman is a lot older and she's trying to have kids, she has a higher chance of having abnormal chromosomes during her pregnancy. Some treatments that physicians usually prescribe for a female with a blighted ovum would be just to let the woman's body naturally pass the miscarriage. That usually occurs within 4 to 20 weeks of the pregnancy. Second treatment option would be a woman using being prescribed oral medication. The oral medication does come with some extreme pain. It comes with extreme menstrual cramps, heavy bleeding, and this can also take up to a week and a half. So this is kind of a painful way to do it, but they usually try to prescribe that. There's also a third procedure, which is a outpatient procedure. It's a DNC provided by the physician, and risk with that is usually the woman gets put to sleep or sedated, and you have other risk factors with that, not waking up in time or complications. Okay. In closing, I would like to leave you with this. I hope that from my speech that you learned about what a blighted ovum is, some causes of a blighted ovum, some risk factors that can increase a woman's chance of having a blighted ovum, and also that when sometimes life gives you a curveball and hits you on the chin, you can get right back up and keep driving on. And it's not the end of the world. So lastly, I'd like to leave you with a quote. Life doesn't get easier or more forgiving. We get stronger and more resilient. That quote is by author Steve Marabelli. Thank you.